Long-awaited Austin facility for people who've gone through a mental health crisis is one step closer to opening its doors this morning.
It's expected to be a huge help for the first responders who've been forced to handle a lot of the mental health emergencies. Alicia Inns is live there this morning with an in-depth look at the center. Good morning.
Hey, good morning. We are at the new Guy Herman Center for Mental Health Crisis Care. And here's the deal, guys. I wanted to be able to show you inside this facility this morning, but this project and this facility is really the product of a lot of hands on deck making this become reality. And they wanted to keep this protected until the open house a little later this morning. There are some things I can tell you, though, like where this is situated. You might remember we covered the actual groundbreaking of this last year. We're in Southeast Austin this morning, and this facility is going to be operated by Integral Care. That's the county's mental health authority, and it is going to provide short-term care for adults experiencing a mental health crisis throughout Travis County. And here is some proof of just how needed this center is, because last year Austin police responded to about 12,000 mental health calls, and so far this year they've hit about 6,700 and climbing. That number is still going on. As for this center, what it's going to provide here, it has 16 beds inside, and the average stay for a patient is going to be about 3 to 5 days. Officials expect the center to serve about 1,400 patients in the first year and 1,600 in the second year of opening. And the people who've worked to make this center become what it is today say for some psychiatric cases, emergency rooms and jails are not the answer.
Get their crisis resolved. It's not going to solve their problem. They still have mental illness, but we can then assess the situation better and get them into the appropriate services. And so that's the hope of what this center will do.
It's needed, and it's going to be a valuable tool for the police department. I can't stress enough how much everyone's worked together to bring this to Austin.
It's a big day for a lot of people, and I do want to note this is just the open house today. The center is not open yet. It's opening a little later on this month to those patients. And when I say patients, this is also not a walk-in type of clinic. This is something where these patients get referred by different departments to come here and get the help that they really need. John, I'll send it back to you.